So today we're going to talk a little bit about who's a candidate for liposuction. A lot of people come in and they've tried non-invasive things like Cool Sculpt and Sculpture and things and just really don't get much of a result. So we're trying to take somebody who has this kind of ill-defined waistline, we can really narrow it down and give them some definition like this. The different fat compartments and who's a candidate for liposuction. First of all, you can't be obese. Your body mass index has to be less than or equal to 30. We've got two main compartments that we're really addressing. We're talking about subcutaneous fat that lives right underneath the skin, and we're going to call that surgical fat. So in other words, we're going after this area right under the skin, but above the muscle. The other fat, that compartment that we have, is what we call visceral fat. That's on the inside. This is only responsive to weight loss, but this is not surgical fat. In other words, I cannot go in with liposuction and take that out. Okay, so this is somebody illustrating if you pinch the skin together, and it's showing the different levels and layers of fat. There's the skin on the outside, there's the subdermal fat that lives right underneath the skin here in green, and then there's the fat that can be suctioned, and that's the deep fat. The reason you can't take every single fat molecule out is because the blood supply runs in this subdermal fat, and that's what supplies the skin. So only the purple fat can be taken out, and this little bit of green fat layer needs to be left behind. So it's never like the back of your hand where it's this wispy piece of skin left behind. 47-year-old came in for mommy makeover. Basically what we want to do is flatten the front and give her some definition back here. You can see how she is post-operatively, how flat she is, and how great her curve definition is here. That's because we were able to target the subcutaneous fat here. The visceral fat is fat that she'll lose on her own afterwards, but you can see again how flat she is in the front and what a great curve she has in the back. Okay, so this is a 47-year-old, and we felt like she was a good candidate, had good skin tone, had some focal lipodystrophy, and was not obese. Her goal was to try to get flatter tummy and have better overall curves. So if this is something that sounds appealing to you and that's something that you might want to do, feel free to give our office a call, and also check out our website where you can see some before and after pictures.